And we are live.
Okay. We are live and welcome to AI Arthritis Voices 360. This is the official talk show for the International AUTOimmune and AI Arthritis for short. And we're doing something pretty special this week. We have Auto Ball, which is our first gala that we were going to have offline in St. Louis, Missouri for the first time. We were moving offline and we were going to introduce ourselves to the community publicly. And now we're back inside because of COVID-19. But that's okay because now we're just going to stream the podcast that we were going to do it way at the Auto Ball here online. And I'm not alone. If you are sitting here tuning in with us, you see that there are other people on the screen with me. So my name is Tiffany. I am one of your co-hosts. I'm also the CEO of the foundation, and I'm a person living with non-radiographic axial spondyloarthritis. And I have it's lovely Danielle. Hi, Danielle.
Hi, Tiffany.
How are you?
I'm doing pretty good. How are you?
I'm doing great. So why don't you introduce yourself to everyone?
So, as Tiffany said, my name is Danielle Das, and I volunteer with the AI Arthritis periodically. I have co-hosted a few episodes of Voices 360, which is fun. And I'm a recently retired teacher. I taught government and human geography for about 15 years. And one of the topics that we cover in those courses is epidemic and pandemic spread. So I've been doing some of the COVID-19 coverage, which is
yes, and which is what we're going
to
to focus on here. And you also are a person living with these diseases.
And I am. I have, and my diagnosis is kind of a confusing mess, but I have rheumatoid arthritis. I have axial spondyloarthritis. I also have primary biliary cholangitis, which is an autoimmune liver disease. And I have a rheumatologist who thinks that I may have had a juvenile idiopathic arthritis that was missed as a kid. So that's, people are like, what's your diagnosis? I'm like, I don't know.
AI arthritis.
Yeah, exactly. That's why I like the umbrella. I'm like, I have arthritis. Yeah. I have a few.
And you see, we're still not alone because there are others lurking around here. So we wanted to give a shout out real quick to our production team. Hey.
Hello.
There's Ryan. So
Howdy.
Not only is Danielle one of our co-hosts, she's married to one of our producers.
Hey. I am.
So we wanted to give a shout out and thank these guys because without them, there's no way we would have ever been able to launch the show and build it up to what it's become. So just a quick shout out and thanks to Ryan and to Bill for coming on board and really bringing the show to life. So just a personal thank you for that.
It's been always happy to be here.
So, all right. Well, we'll go ahead and get to the show. Bill, I know you've got some kids waiting, and
I gotta go take care of my kids. So I'm also happy to not be here.
All right.
Are you punch in your headphone now, Danielle?
Yes, please do.
All righty. And Ryan is off. All right. So the topic today that we are going to talk about is we're gonna revisit the whole COVID-19. So it was the reason that we are here online because of COVID. We were not able to do the physical ball, but also we started as an organization, as all really the nonprofits have, needing to address this issue. It's something that is important to our community, people who are high risk and being affected by COVID. So we decided that we would start an entirely separate stream of COVID specific talk shows based on this AI Arthritis Voices 360 show. And Danielle has been a couple of those that we've had. You were on the first one?
Yeah, we
Yeah.
did the very first one about, the whole idea of controlling the spread and flattening the curve. And then I also did an episode about masks and then another one about gloves.
Right. Okay. So we have had 10 now. And so all of those episodes can be found on our website. We set up at aiarthritis.org/COVID-19. We set up a special page that has links to a variety of resources from other organizations and governments from around the world. We also have some of our own materials that we've created, and we have 10 of these episodes. Some are longer, some are shorter, which we call mini-sodes. And Danielle was in the first one that we did with Joe Coe at Creaky Joints. He's fun. I love
Yeah.
Joe Coe. Shout out to Creaky Joints, because they have done an excellent job of creating resources in COVID-19. So we did one on an overview of the pandemic, which Danielle is going to give us a kind of a highlight reel, if you will, of what we talked about there. She did such an amazing job. There's some other ones. I'm looking at the list here. We also had a COVID-19 Ask the Roomie, and that was with Dr. Kim, who was on Saturday for another episode. And we also are launching our breakout series Roomie Rounds with him as well. That we'll definitely share more with you about that as we're doing the auto ball. So you are familiar with patients and rheumatologists coming to the table. That was with Matt Eisman, and he is the host of American Ninja Warriors. So you have links to check that one out. We also did some on Not My New Normal. We did reality check from high risk patients. We did a lot of stuff. So you need to go. We'll have to make sure that we link to that and everybody can check it out. But right now, what we really wanted to do was part of the auto ball is to let everyone know, number one, we're here, our nonprofit, but a little bit about who we are, what we do. So our mission is we help others like ourselves, like Danielle and myself, people living with these diseases, have a voice alongside other stakeholders as equals at the table so that we can solve problems together that impact education, advocacy, and research. And the kind of neat things I think about our organization as well is, like Danielle said, many of us have our professional backgrounds that we bring to the table as well. So we're kind of dual stakeholders, right?
Yeah.
People living with these diseases and have professionals. So I'm going to hand it over to Danielle to take it away in respect to kind of explaining the whole epidemic, and you did so eloquently in that first show. So we'll give some everybody a little glimpse into what the amazing information that you gave the first time around.
Okay. So just to review very briefly, a pandemic is any disease that has a widespread across multiple countries, particularly multiple continents. When epidemiologists are looking at it, we're looking to see, does it cross multiple oceans? Does it have multiple epicenters? When you plot the cases on the map? I was looking at the Johns Hopkins Research Center today. They've been doing a great job of mapping the cases. And when you look at the cases right now, there's just a giant bloom of cases over the United States, giant bloom over the European Union. Outbreaks all over all of the continents, with the exception of Antarctica, which makes sense because there's not any people there. And there's not really any areas where there are no cases at all. So it's pretty easy to look at that and go, yep, that meets the criteria for a pandemic.
Yes. Yes, it does.
It's and so to anyone who is I have actually seen people saying, well, but is it a pandemic? No, it definitely is. Because there's a lot of confusion about what the word means. A pandemic doesn't necessarily mean a certain degree of severity of symptoms. It doesn't necessarily mean a certain mortality rate or anything like that. It just has to do with physical spread of the number of cases. And so that's what scientists are referring to when they say pandemic. Now, COVID-19 in particular does have a pretty high mortality rate. And one of the things that makes it unusual is that the mortality rate is not isolated to those traditionally at-risk populations. You know, if you look at something like influenza, we see the elderly and the people with underlying conditions, which of course is us. You know, those at-risk populations are affected. One of the things that's unique about COVID-19 is that it doesn't stop there. It spreads pretty wildly through your healthy adult population, your people that don't necessarily have underlying conditions. And even though the mortality rate is not as high among them, it is still pretty startlingly high. And so the mortality rate is also of concern with this particular disease. I believe I was looking at around 300,000 deaths worldwide so far, which, you know, if you consider that's really just since December, that's a lot. So, so that's kind of the worldwide picture in terms of spread and mortality. The concentration is a little bit surprising. The United States has the most cases by far. We're about 3 times higher than the next country. And I've seen some people in the news saying, well, but, you know, population. The US actually does not have a huge population globally. You know, when you look at like China and India that have over 1 billion people, our populations are closer to like 347 million. So it's much lower. So there's not a population reason for us to be the number one number of cases. We do have a large geographical spread, which is also another reason that some people are saying, well, you know, it's hard to implement any kind of effective containment strategy when your country is that large. But China is also very large. India is also very large. Both of them are doing a lot better than us. Tiffany and I are both in the United States. So, you know, in terms of globally containment strategies, I have to say, when I was looking at the numbers today, India is doing an amazing job at containment and not really getting a lot of press for it. They had only, I should have written the number down because my memory is not great, but only a few thousand cases so far, and a population, you know, over like 1.5 billion people. They have a very aggressive lockdown strategy that I was reading about. And there are a lot of economic concerns there because they have a large population living below the poverty line. And I would like to see some more media coverage out of India. I know we have some volunteers there. Be really interested to hear, you know, kind of what's going on from their perspective. So that might be something interesting to follow up on later. Excuse me 1 second. But in terms of those strategies, one of the most important things that most of the countries, oh, did I lose you?
Okay, and we're back. So if you tuned in earlier today, I don't know what it is about my internet, but this is the second time it's booted me out today. So we apologize for the interruption there. And Danielle was so eloquently explaining to us about this. So I don't know when I dropped off where you were at.
Well, let's just jump back in. I'm not sure either.
Okay.
So that's, we kind of had talked about, spread, and a lot of what's in the news now is people looking at, well, this country is doing this or this country is doing that, and looking at containment strategies and looking at new cases, and all of the efforts that people have been doing are to flatten the curve, so to speak. And the idea there is that when you track the spread of disease on a graph, the number of new cases will steadily go up for a while, and then it will plateau for a while, and then it should, in theory, descend. That's how most disease progressions go. And the reason it descends will be different for all of them. If you're looking at something a long time ago when there's no modern medicine, like the Black Plague or something, it may literally just be that the disease has run its course. It's killed off everybody it can. Now it's usually more something like modern medicine figures out a effective strategy for handling it. But at any rate, so you end up with this sort of bell curve. And what we want to do is have that curve be as fat and short as possible, as opposed to tall and skinny. Because the hospitals can handle as many people as they can handle. And there's not a whole lot we can do to affect those numbers. Now, we are seeing some efforts to increase the capacity of hospitals. I've heard of, setting up field hospitals in sort of a temporary situation. But at a certain point, you can't generate new doctors. You can't generate new nurses, because that takes years of training. So the number of people that you have is the number of people that you have. What we can do is increase things like the number of beds, the number of ventilators. Even that takes time, but most of the governments have done what they can to try and beef up those numbers. But at a certain point, your capacity is what your capacity is. And so you want to make sure that you don't have more people coming into the hospitals than you have resources to treat them. And the best way to do that is to keep that curve, sort of a low fat shape as opposed to a tall skinny shape. The unfortunate sort of side effect of that is that it does draw out the amount of time that the disease is going to be around necessarily, because these patterns, they are going to either burn hot and fast, or they're going to burn long and slow, but it's going to be one or the other. You're not going to have slow and fast. That doesn't really work. So,
Right.
So in order to keep the disease at a level that we can handle in terms of hospital capacity, that does mean extended lockdown periods. It does mean extended quarantine periods. It does mean, extended safety protocols, longer terms of social distancing. And the longer that people are having to do this, the more we're seeing people being frustrated by it and getting tired of it. And yes, there is definitely a mental health aspect to it. It's just not easy. I think when we went into this, a lot of people thought, oh, stay home, piece of cake, I can do that.
Right.
And our community, we can do that. We know how. We have experience in that. But a lot of people don't.
Now, I've worked from home here for a while. This is
Exactly.
not a new normal for me whatsoever.
Yeah, exactly.
And Danielle, feel free to take a breath and too when you need to. So thank you for that overview. And I think that that's just important to bring up because this has all happened so quickly. Gosh, it was only a couple months ago we did that first episode when you explained all of this. Now here we are reopening the countries, reopening the world. I mean, little by little, people are reopening, and there's still hot spots that need to remain closed for the reason that you said. And that's why I wanted you to reiterate this, because there is a lot of frustration. And of course, we want economies to be strong. And there's a lot of different perspectives and experiences that we must respect. Regardless, we all have our own. There are people that need to work, and what we just have to remember is, if especially if you live in an area that could see high levels of contagion,
Mhm.
and then you need to make sure that the not only you have enough hospital beds, but as you said, that the staff is there
Yeah.
and the staff is well enough to be able to take care of those people. So
Right.
all of
And
that is just something to remember.
people need to understand that this is not a political issue. It's not a partisan issue. There's no sides, and the situation is going to evolve, and people need to be able to adapt to it as it evolves. If you live in an area that reopens and your cases start to go up, which they absolutely will, that doesn't necessarily mean that reopening was the wrong decision. But if the
Mhm.
cases going up exceed what your hospital capacity can handle, then you're going to have to lock down again. And you need to be emotionally prepared for that. And that doesn't necessarily mean it was the wrong choice unless people resist being adaptable. Because you have to trust the local medical professionals that are telling you this is what we can handle. And
Mhm.
that's really, really crucial. Otherwise, we're going to end up in situations where people are dying that didn't need to.
Right. Exactly. Exactly. And we just as to let everyone know, what today is Monday. Tomorrow afternoon, we are having Carrie Beach from Rheumatology Nurses Society, who has been on the weekly Thursday COVID-19 town hall meetings every Thursday with RNS. So they're going to she's going to also shed some light from the rheumatology perspective as well. So definitely come back for that too. Something that I wanted to mention here as well. Well, a couple of things. First, it's just so interesting, like you said, Danielle, and a lot in our community have said this is not our new normal by
Yeah.
any means. But what I would like for people who are not living with our diseases to take away is that life can go on. You have to adjust to it. And I've said this quote a couple of times. It's really from Kelly Conway, our one of our co-founders, is that, we say having an AI arthritis disease isn't the end of the world. It's another way of living in it.
Mhm.
And it's very similar to everyone who's dealing with COVID. We don't know if if that's normal, will go back to normal like pre-COVID. We don't know what normal is going to be moving forward. But as a community, we hope that we can at least provide some guidance and advice as people who have had to deal with the new normal. And
Yeah.
ours is forever changed, and we adjust, and it takes some time, but we definitely have some experience in that, no doubt. um so Danielle, I don't know, we're not important for patients, and if people are tuning in and you want to ask us a few questions, we're not experts, but we are people living with these diseases, and if we
Mhm.
do know some of the answers, we'd be sure to share those with you. I see quite a few people on from Washington. Hey, Missouri. Hey, I'm from Missouri. I'm in St. Louis right now. So I see California. um Something that has been really frustrating to me. You mentioned the uh the the death rate, the being the
Mhm.
more being uh that's the number that they always look at. And
Mhm.
I have heard so many people saying, well, the death rate's not as high as we anticipated, so this isn't a big deal. It's just the flu.
Yeah, and see what people need to understand is the death rate is not as high as was anticipated because we have been doing the flattening of the curve and because it has been working. And if they would step back and consider that 300,000 people are dead, even with the entire world basically locking down to protect each other, that's amazing. I mean, consider how many people would have died if everybody had gone on business as normal like they do for the flu. I
Right.
mean, I can't even begin to pretend to guess how many people would have died. It would have been catastrophic. And every scientific expert agrees on that. Your friend that you went to high school with that failed biology may not, but everybody with letters after their name does.
Right. Right. And something that I'll share. I know Danielle knows this, a lot of people know this. I've been very vocal about it. I was even on the early podcast shows, I kept saying I was so frustrated I couldn't get a test. Couldn't get a test. And I thought I was meeting all of the criteria. We still don't know
Yeah.
100% that my doctors have ruled my specific case as a false negative.
Mm-hmm.
And that is simply because of the presentation, the symptoms. And then it went and attacked my heart. And when we first started these podcasts, these shows about COVID, it was only considered a lung disease.
Yep.
It affects the lungs. Well, now this happened to me, it was only 2 weeks of research from China talking about how it actually was affecting the heart. Now we know also the brain
Yep.
and other areas of the body. And so for me, it's very frustrating because assuming that I was affected, and that's what caused the heart inflammation that I was experiencing. Never had anything like that before. It really is, it personally frustrates me to hear people compare the death rates because this is different than the flu. The flu
Yeah.
isn't going to Okay, we're going to try this one more time here. I removed the backdrop to see if that helps with the internet. And then before we do the next episode, which will be in an hour or two with Deb Constein on conferences, I'm going to move around in my home and see if I can find somewhere that's going to support not popping me out. But what we were talking about was just that it's really frustrating for people who have been affected by COVID in more ways than death because it's something that has many levels and we have not even figured it out yet where it's going. And the reason that I wanted to point that out was because of our diseases themselves. And I think it's really important that those who feel that they have been impacted by COVID, whether you were tested and your doctor feels it might, like me, that it might have been a false negative, or if you just never received a test, there's a lot of research going on right now, and I think it's really important that as many people as possible get involved in in those activities, and I'm going to. When we wrap up here, I'm going to give you more information on how to get involved in those. But Danielle, I wanted to turn it back over to you and just ask you if there's anything else specifically that you thought that we should point out for COVID, things that have progressed since we talked on the episode just a month or what it was.
Yeah, it was not too long ago. The only thing I would say is, especially to people living in areas that are starting to reopen, I would probably recommend that people, um, uh, make sure that you're wearing your mask if you are required to do so, if your doctor has recommended it. Um, the But just be careful going out, because just because something is open doesn't mean that it's safe. Just because you have a mask on doesn't mean that it's safe. Wash your hands aggressively and all the things that you've been doing. Just kidding.
And we'll be back after technical difficulties.
Yeah.
Thanks for joining us again, guys, for the Auto Ball. This has been a blast so far, barring the internet. It's the only thing holding us back right now. So come catch us soon, and we will be back with some more awesome content. Thank you so much for coming on, Danielle. That was awesome. I'll be brief.
Thanks for having me.
Yeah, and I'm sure we'll have some great conversations real soon.
Okay.
All right, bye, everyone. See you real soon.
Bye.